So the background of IMA203, it's known as anza-cel. The idea was if you could target a cold tumor microenvironment with a T-cell receptor against a highly expressed protein or peptide, would this actually be a strategy to develop an immune response? So in this cohort, we looked at the uveal melanoma patients. Uveal melanoma is the most common adult cancer of the eye. It's the second most common type of melanoma outside the skin, but it meets the WHO and National Cancer Institute definitions for rare cancer. It only affects 0.6 to 0.7 per 100,000. So that's 6 to 7 persons per million in the general population. So it's a rare cancer despite being the most common adult eye cancer. The dilemma in uveal melanoma is that half of patients will metastasize and usually die from their metastasis. It predominantly involves the liver, so death is liver failure. And despite having 15 years of advancements in skin melanoma, most of these treatments were neither tested nor effective in uveal melanoma. So we need therapies that really work in this particular disease. So IMA203 anza-cel targets PRAME. PRAME is a peptide or protein highly expressed in cancer. In uveal melanoma, we think it's expressed in more than 90% of metastatic tumors. And PRAME is processed into different peptide fragments and then carried to a tumor cell surface in the context of an HLA molecule. So anza-cel, IMA203, is the investigational product that is transduced with a T-cell receptor that recognizes the specific HLA PRAME complex. Patients are tested for HLA in their blood. Their tumor is tested for PRAME expression. And if both of those are positive, then they undergo leukapheresis. Anza-cel is then manufactured from their white blood cells to be transduced to recognize this HLA PRAME complex. And then the patients receive some lymphodepleting chemotherapy, anza-cel one-off infusion, and 10 days of low-dose interleukin-2. So this was a phase 1 study. The primary objective of phase 1 studies are typically safety and determining the recommended phase 2 dose, RP2D. In this study, we found that the IMA203 anza-cel is quite safe to administer, but there are some expected toxicities to be aware of. In most cell therapies, there's toxicities from the lymphodepleting chemotherapy, and that's what we saw, is that most patients had some degree of cytopenias, neutropenia, anemia, etc. Those are transient and very self-limited. All patients experienced cytokine release syndrome. The median onset was day 1. Median duration was 9 days, and there were no patients with long-term side effects or cytokine release syndrome. Importantly, there were no deaths from the anza-cel treatment, and that's in the 16 patients with uveal melanoma, but also in the totality of the 74 patients treated in the phase 1 study. As far as efficacy, which is a secondary outcome, all 16 patients with uveal melanoma had some reduction in their tumors. So this is pretty remarkable to see all patients getting some benefit. 66% of patients had a confirmed response. So that means a response that was then maintained for at least 4 weeks. And over 80% of patients had some benefit in terms of disease control rate. So stability or a response for at least 6 weeks. So the next steps off of these data of 16 patients with uveal melanoma, we're very excited to say that this will be confirmed in a phase 2 trial. Uveal melanoma is a rare disease, and we understand we don't always know what to randomize against, but still we do believe that this cohort is important. The fact that all 16 patients had a reduction in their tumor burden means we want to see if this holds up as we enroll more patients in a phase 2 study. So anza-cel is being also studied in a phase 3 randomized trial in cutaneous melanoma. So we have hopes that it will be effective there because skin melanoma also has a high expression rate of PRAME. There's this phase 2 in uveal melanoma. That's hopefully a confirmatory trial of these phase 1 results. We actually think mucosal melanoma has a high PRAME expression rate, as well as many, many other solid tumors. So really, we hope that we're proving the point that what works in this cold tumor, such as uveal melanoma, typically not immune responsive, if you target a highly expressed protein with a specific T-cell receptor, you might be able to engender some clinical benefit. And PRAME might just be the target, and Anza-cel might just be the drug.